So basically what happened is that our ankle, instep of our ankle, we have 5 ligaments, but outside we only have 3 ligaments. So inherently when you sprain the ankle, it always sprains to the outside, 95% of the time. So you always sprain on the outside. Sometimes I see the instep area, but very uncommon, most of them here, and then all kinds of different things, sports, or you're just walking down the street and missing a step, all kinds of things happen here. Now when they first come in, I take an x-ray to see if anything's broken. I just saw a patient yesterday, had this sprain injury during basketball 5 years ago, young gentleman, and he said whenever he does the same thing, it's been hurting, but now lately it's been really hurting, where he couldn't stand too long. So I got an x-ray, lo and behold, there's a fracture there that never healed. So sometimes that happens, but most of the time the ligaments, which is a very tight rubber band type of thing that supports the ankle bones, either ruptures or attenuated. We call them stretched out like a rubber band, and then it becomes constantly unstable. So it kind of constantly giving out because it's not stable as they're standing or doing other activities.
So why would he get that sharp periodic pain, and what could have caused that?
Right, because now what happened is that because this is not stable, because ligaments are not together, ankle is what we call a hinge joint. It only works in one direction, which is up and down, this motion, okay? It's not supposed to move side to side, okay? It's anchored in this very tight bone structure. So now it's loose, we're constantly hitting the other bone because it's not moving straight like this anymore, but it's doing these numbers. Oh. That's why when this jams into that joint, they feel sharp pain. Because there are a lot of nerve endings there.
Right. Yeah. So you want to know, okay, now they understand all the mechanism and why and all that. So how do they fix it?
How do they fix it? Okay. So if we take the x-ray first, and then if the x-ray shows no problem, x-ray is all looking good, then there's no bone problem. So now we're looking at the ligaments now. So we have to order an MRI to have a 3-dimensional picture of all the soft tissue structures, such as ligaments, tendons, capsule, joint, inside. You can look at everything to see if there's any damage done, not only to the ligaments outside, but a lot of times inside the joint, because it went wrong direction, all the cartilage may have been damaged, which can be a big problem in the future.
So he said that with the surgery, would that allow them to be completely healed? And would they be able to resume sports, or would they be at risk for having recurrence of injury again?
Once you surgically get it fixed, and it's amazing, it feels very, very stable, where they can pretty much go back to all the other activities, even better than they before. Because they've been walking and kind of not stable for a long time, so they haven't been able to do a lot of things, even standing and walking around, but now they can really do a lot because this really tightens up and it makes it very stable. After surgery, you're in a cast for about 4 weeks because you cannot walk on it either, because we want the ligaments to reattach into the bone. So we use this anchor, and it gets it really tight in there, and if you walk on it, then they can kind of mess up the whole surgery. So we like you to stay completely off your feet, but you can get around, but you cannot put weight on it, so either crutches or knee walker or different gadgets, you can walk around initially. And then when you come out of the cast, you go into a walking boot for about another 2 to 3 weeks. At that time, we start physical therapy. Physical therapy is to massage the area, use the ultrasound, electrostimulation, other things to get the swelling out and allow that scar tissue to set in nicely. So that whole thing takes about 6 to 8 weeks, and you can go back to your shoes at the time. Initially, you may have some swelling still residual, but over time, they go away, and you can resume all your sports activity within 3 months.